All right, I want to play this sound because I think we got it now. This is what the Republicans are saying about having to pay for this thing. They say it would dig us in a big hole. We'd never get out of it. Here it is.
The $1.5 trillion that this plan is going to cost is going to be a new tax on small businesses that will destroy more American jobs.
The cost is going to be borne by the people of this country, the middle class, the wealthy, those who can least afford it. All of us are going to be paying an astronomical cost at a time that we just cannot afford this ambitious grab.
You believe that, Mr. Reich? What do you think?
Well, look, Ed, we've heard this fear-mongering every single time there's a national health care bill. You know, when Bill Clinton came up with a plan that was, granted, too complicated, we had the same groups making the same claims. Look, this time around, all you have is a public option. Now, it's not a requirement. Anybody can keep their own private insurance, but there is a public option. And also, there is, coming out of the House and hopefully the Senate, a small, very tiny tax on the top 1% or 1.2% of Americans who, by the way, now are taking home about 20% of total national income. I mean, if anybody can pay for the health of everybody else, it's the wealthy. I mean, let's have the wealthy pay for everybody else's making sure that America's healthy. It's a good bumper sticker, but it also makes a lot of sense, Ed.
Mr. Reich, great to have you with us tonight. I appreciate your time here on the Ed Show. Thank you.
Thanks very much. Bye-bye.
Now let's go to our panel. Sirius XM radio talk show host Joe Madison, and also U.S. managing editor for the Financial Times, Chrystia Freeland, is with us tonight, and Republican strategist Ron Crisy. Joe, let's start with you. A fired up Barack Obama, President Obama today. Is that going to help at all?
Oh, I think it's going to help, and I bet you within about a half an hour from now, he'll fire up about 3,000 delegates to the NAACP convention, not far from here. And the message is very clear. He has to fire up the constituency like you have tried to, I've tried to on my show, because that's really the only thing we have to counter what you just heard the senator talk about and the former Secretary of Labor, and that is the power of lobbyists.
They're all there. Chrystia, how much of a role is the president going to play from this point on? He's been very clear on public option. It seems like, for lack of a better term, he might be doing some arm twisting right now on some conservative Democrats. But if he doesn't deliver on the public option, as Joe just said, he's going over tonight to talk to the NAACP. If he doesn't deliver a public option, is he really failing his constituents who helped put him in office? Labor, wage earners in this country, new people to the process, the young demographics that are out there in the political process that all know about this hope and change, and of course the NAACP. What if he doesn't get public option in?
Well, this president likes to talk about the best being the enemy of the good, and is very much someone who is focused on achieving what is achievable. Having said that, I agree with you that the public option is really essential for true health care reform, and one of the nightmare outcomes that you could have is some sort of reform which is a half measure and ends up making things worse. And I think the way you could get to that would be maybe to have coverage extended, but not to have action taken to bring down the costs, which is one of the things that the public option could do. I mean, one of really the ridiculous things about the American healthcare system, if you look at it from the outside, is America spends more on healthcare than other Western industrialized countries, significantly more, but actually has equal or, in most cases, worse outcomes. So you should be able to have reform that gives more coverage and costs less money, and I think that has to be the target that the president aims for.
Ron Crisy, I've been wondering about this. Why don't the Republicans just give President Obama what he wants? And if this public option is so bad and it doesn't work and it costs so much money, heck, you guys will stroll right back into power and get whatever you want in a few years. Why not just let him go down the road? It's what the people want.
Well, I think that's a really good point. And I think, you know, also the Republican opposition to the public option suggests a certain lack of faith in the competitive powers of the free market. Okay. Right? If you think that private health care is so terrific, then let it compete against public health care.
All right, Ron, what do you think? think of that? What do you think?
Well, I got to tell you, Ed, I think that the Republicans are doing the smart thing by putting their foot down and ending the trifecta of Democratic irresponsibility. First, you had the stimulus bill that we were told it was going to keep unemployment underneath 8%. Now it's 9.5%. Then we had the cap and trade bill that the Democrats said that it was going to reduce global emissions. Well, China, the largest emitter in the world, is exempted, so is India. Now you have this health care bill. Nobody's read it. The cost is astronomical. And what I find astounding, Ed, if you look in America today, nearly 49% of the American people have chronic diseases or they're going to develop chronic disease. Nearly 1 in 3 people in this country are obese. This is a $1.6 trillion bill, and they haven't spent anything in this bill dealing with prevention, and yet 75 cents out of every health care dollar spent in America is dealing with chronic disease.
No, wait a minute. I think there is quite a bit about this in prevention in coming from the Help Committee, and there's also quite a bit about prevention coming in the House. In fact, the public option is all about prevention, Ron.
I hate to tell you, Ed, I'm a healthcare expert. 75 cents out of every dollar spent in this country is for chronic disease. There is not hardly a nickel in this bill dealing with prevention of chronic disease. That is the major driver of healthcare costs in this country, Ed. So if we want to have an honest discussion about
we're having an honest discussion here.
No, we want to talk about how we can reduce healthcare costs, Ed. Why aren't we dealing with chronic disease?
Well, chronic disease. How about people who have got a chronic disease, Ron, and they can't go get coverage because of a pre-existing condition? That's what this public option is going to do for people.
Ed, I'm more worried about the cost. I mean, if we're talking
it's not what you're worried. Now, wait a minute. Now, it's not about what you're worried about, Ron. It's not about what you're worried about. It's what about is available to the American people. We're trying to make sure that the American people are as healthy as possible, and we're doing nothing to ensure that the people who are the sickest are taken care of.
What an elitist statement. I'm more worried about the cost than I am people staying alive.